Now to coronavirus. There's been a slight uptick in COVID-19 cases reported around San Diego County in the past few days. ABC 10 News reporter Mimi Alcala joins us live in Kearney Mesa. And Mimi, wastewater surveillance shows that the virus may be spreading more than what's actually reported.
And Lindsay, some doctors say we should start thinking about being cautious again, especially in crowded areas, as pandemic restrictions and mask mandates have mostly been lifted.
There were 321 new COVID-19 cases reported in San Diego County on March 23rd. While cases are only slightly up based on testing data available, Dr. Abisola Olulade with Sharp-Reeve-Steele says recent wastewater surveillance shows there has been an increase in the virus spreading locally.
So essentially what we're seeing is there's an increase in terms of the levels of COVID in wastewater surveillance, and that's actually almost doubled in the last week.
The San Diego Epidemiology and Research for COVID Health, or SEARCH organization, which is made up of local institutions, reports that the rate of COVID in wastewater started to rise in recent weeks. People shed fragments of the virus in urine and stool, and scientists study those sewage samples. Dr. Olulade says what they're seeing could mean another surge in cases is on the way here in the county.
The standard that we use in terms of determining cases of COVID are those tests that are performed by medical providers, but wastewater surveillance is actually potentially predictive of that.
The medical director of the county's epidemiology and immunization department sent us a statement saying wastewater is one indicator that should be used, along with case counts, ER traffic, hospitalizations, and deaths. We know there is still COVID in the community. There has been an uptick in recent days. However, it is nowhere near our peak last January. But it serves as a good reminder to everyone COVID is still here.
And we have to remember that ER visits and hospitalizations and deaths lag behind case count. So it's often too late when we realize that there's a surge.
And Dr. Olulade says case counts may be an underestimate of the levels of COVID actually in the community because some people are asymptomatic and don't get tested, or they take at-home tests and don't report those results. Either way, she really encourages vaccinations and boosters. We're live in Kearney Mesa. Mimi Alcala, ABC 10 News.